Okay. With all the names she's in.
Oh. Oh, she's here.
There we go. Do we name?
So, okay, if we Google the definition of comorbidity, this is what Dr. Google is going to give us. Is the simultaneous presence of two or more diseases or medical conditions in a patient. And is also a disease or medical condition that is simultaneously present within another or others. And we briefly talk about this on Tuesday. So I'm sure you know, given your backgrounds, that cardiovascular disease, stroke, diabetes, hypertension, and Alzheimer's or dementia, they are somewhat interconnected. And this may be a manifestation of comorbidity. And the presence or absence of arteries buildup in the heart can affect the heart's ability to pump blood, and it can also affect the speed of pumping blood. And sometimes oxygen flows through when the heart is pumping blood. And because of that, these can affect the quality of blood flow to the brain matter. And this in turn affects how well the brain is going to function. And this ultimately affects a person's risk of getting Alzheimer's or dementia, or to a lesser extent, a person's cognitive health. So this is a manifestation of how heart disease can also affect the risk of cognitive health, like Alzheimer's disease or dementia. And sometimes carbohydrates, fats, and vitamins are also carried through our system. And this can also affect how well the brain is going to function, which in turn affect our memory and cognition. So, the ability and the speed of the heart in terms of pumping blood can affect the quality of brain cell. And this ultimately determines a person's risk of Alzheimer's disease and dementia. And the heart ability to pump blood and the speed of pumping blood can also determine how the blood supply is going to be like. The heart's ability to pump blood or the speed of pumping blood. In this process, if the blood supply is not cut off, the person's risk of getting stroke may be none or very minimal. If the blood supply is being cut off, it can increase the person's risk of getting stroke. So, in this case, we see that there is a connection between heart disease and stroke. It's another manifestation of comorbidity. And if the person has got a stroke, at some point in his or her life, this is going to affect how the person's brain is going to function. It's a no-brainer. It's another manifestation of comorbidity. In this case, between stroke and brain function, which in turn can also determine the person's cognitive health or the person's risk in a few years of getting Alzheimer's disease and dementia. So this is also another manifestation of comorbidity between stroke and cognitive health, or between stroke and Alzheimer's disease or dementia. And if the person is diabetic, this can affect the quality of his or her blood vessel, and this can in turn affect the person's memory and cognition, according to research. So another manifestation of comorbidity between diabetes and cognitive health. And if the person is diabetic, it can affect the quality of his or her blood vessel, and this can affect the blood flow to the brain, and this can affect how well the person's brain is going to function, which in turn affect memory and cognition. Another manifestation of comorbidity, in this case, is also between diabetes and cognitive health. And if the person is diabetic, it can affect the person's ability to process sugar and insulin. And these can affect energy and neural communications in the brain area. And this in turn affects how well the person's brain is going to function. And these may ultimately affect the person's memory and cognition. Another manifestation of comorbidity. And if the person has hypertension or high BP, it can also affect the person's memory and cognition through the quality of blood vessel. Another manifestation of comorbidity, this time between hypertension and cognitive health. And having stroke can increase the chances of getting hypertension, and this in turn may affect the person's memory and cognition. Is yet another manifestation of comorbidity, this time among stroke, hypertension, and cognitive health. So it seems to me that this diagram illustrates comorbidity among cardiovascular disease, stroke, diabetes, hypertension, and cognitive health. So this is a manifestation of comorbidity.